Understanding SIBO, or small intestinal bacterial overgrowth. Did you know? The small intestine's primary function is to digest food, absorb nutrients, and move remaining undigested waste material to the large intestine. Surprisingly, a healthy small intestine does not have much bacteria compared to the large intestine. This is because most bacteria have been killed by gastric acid as food passes through the stomach. The maintenance of this relatively low bacterial load in the small intestine is dependent on many factors, including normal gut motility. What is SIBO? SIBO is a condition of dysbiosis where bacteria normally found mostly in the large intestine colonize the small intestine, resulting in larger numbers than usual. These bacteria contribute to fermentation of sugars in the small intestine, resulting in the production of various gases, which may cause symptoms such as abdominal bloating. What are the risk factors for SIBO? Altered small intestinal anatomy due to previous gastrointestinal surgery or adhesions, disorders of brain-gut interaction, irritable bowel syndrome, chronic disease such as Crohn's disease, scleroderma, diabetes, thyroid disease or celiac disease, chronic pancreatitis or cirrhosis, and medications such as opioids or proton pump inhibitors. What are the symptoms of SIBO? Common symptoms of SIBO can include bloating, gas, belching, abdominal cramps, diarrhea, constipation, fatigue, and headaches. If you are experiencing any of these symptoms, you should see a gastroenterologist, a doctor who specializes in SIBO and other digestive diseases. How is SIBO diagnosed? Your doctor will need to do the following, including taking a detailed medical history and physical examination, blood tests, breath testing, and possibly an endoscopy. Doctors usually diagnose SIBO using a breath test. In this test, either glucose or lactulose is swallowed. These sugars are fermented by gut bacteria and release gases including hydrogen and methane. These gases are measured in the patient's breath at regular intervals during the test. If the gas levels rise quickly and to an abnormal level, a diagnosis of small intestinal bacterial overgrowth can be made. In some patients, your doctor may also recommend a gastroscopy to take a fluid sample directly from the small intestine. How is SIBO treated? Treatment for SIBO involves a course of antibiotics which include rifaximin and sometimes neomycin, depending on whether you are a hydrogen or methane producer. In some cases, treatment of the underlying cause may be helpful as well. SIBO can come back, especially if the underlying cause isn't treated and repeat treatment with antibiotics may be needed. That's why follow-up and ongoing care are important. Some patients may require retreatment with antibiotics. If you want to know more about SIBO, visit GUTCARE for a consultation today. This video is brought to you in collaboration with